Hi, good morning. I'm Michelle Chang. I'm a minimally invasive surgery fellow at the University of Arizona. Thank you to Stages for the opportunity to present. I have no disclosures. So nearly 9 out of 10 adults have difficulty using everyday health information. We would say that these individuals have low health literacy. They have difficulty finding, understanding, and using basic health information to make appropriate decisions. Low health literacy affects people of all different backgrounds, and low health literacy has been associated with worse health outcomes and higher costs. National organizations have created initiatives targeting health literacy as a priority for improving communication between physicians and patients. The NIH and AMA have recommended that written health information be at the average reading level of 6th grade. It is important that we assess the current patient education material that we provide for their readability. And what this really means is examining for sentence length and word complexity. So low health literacy may specifically pose as a barrier for patients who are seeking foregut surgery because frequently this requires a nuanced discussion of different treatment options, an understanding of the involved anatomy, and going over specific diet instructions after surgery. So the objective of this study was to assess and compare the readability of online patient education material for foregut surgery. Using Google, we searched the terms anti-reflux surgery, GERD surgery, and foregut surgery, and we selected the top 30 results that came from academic institutions and national surgical organizations. We reviewed the material and ran them through different readability formulas as listed on the slide. We then performed a univariate analysis of their reading scores. These are the many organizations for whom we selected material from. So overall, our analysis showed that the majority of resources were far above the recommended reading level, and the average of the scores was actually 12th grade for the material we looked at. And there was really only one resource that was at the recommend level of 6th grade. We noticed that there was a common trend that the pages that had the most amount of information were frequently graded at the highest reading level. And so therefore, being too comprehensive may paradoxically take information out of reach for patients who have lower literacy. This table further shows the breakdown of the reading score among different reading formulas. And we found that across the board, the formulas were consistent with their grading of material with minimal variability. In our analysis, we also observed a common trend that nearly half of the resources did include some form of multimedia, whether that was in the form of videos or pictures, anatomic diagrams. And we acknowledge that multimedia is an important element of online resources that are not being captured or quantified by readability formulas. So in conclusion, we found that most online patient education material is far above the recommended reading level. We recommend using a multimodal approach to convey information to patients, especially using different pictures or videos, and this may help to bridge the gap in understanding for patients who have lower literacy. Surgeons should really be aware of this potential issue in understanding of their patients to help them make informed decisions and improve overall surgical outcomes. These are some of the best practices that are listed by the Agency for Healthcare Research and Quality, and they include organizing with the most important information first, writing in a direct and concise way using bullet points and short lists, avoiding use of too much complex numbers, and avoiding medical jargon and using more familiar terms. So thank you for the opportunity to present, and I would be happy to answer any questions.